Hello and welcome to today's webinar brought to you by Happiest Health. I'm Kumaran P, Assistant Editor with Happiest Health and your host for this session. It's an absolute pleasure to have you join us for what promises to be an engaging and informative discussion. The topic of today's webinar is Diet for Diabetics, a subject of critical importance given the rising prevalence of diabetes globally and the significant role diet plays in its management and prevention. Our natural sweetener partner for this discussion is Stiviacol. To help us dive deeper into this topic, we have two distinguished experts with us, Dr. Vishal Lahoti, endocrinologist, Sagar Hospitals, Bangalore. Dr. Vishal is an accomplished endocrinologist with a strong academic and clinical background. He holds a DM in endocrinology from Narayana Medical College, Nellore, and an MD in general medicine from Mahadeva Parampure Medical College, Gulbarga. Dr. Lahoti has served in notable roles, including senior resident at ESIC Medical College and consultant endocrinologist at Apollo Clinic, Bangalore. His research focuses on diabetes, including studies on serum asparagine and ferritin levels in type 2 diabetes. Actively involved in community health initiatives, he has participated in programs like polio eradication and anti-tobacco workshops, reflecting his dedication to holistic healthcare. We welcome you, Dr. Lahoti.
Thank you very much.
Next up, we have Dr. Mahesh DM, who is an endocrinologist at Aster CMI Hospital, Bangalore. Dr. Mahesh specializes in diabetes, obesity, and thyroid disorders. An alumnus of Bangalore Medical College, he completed his DM endocrinology at CMC Vellore, earning recognition such as the A.V. Gandhi Award for Excellence in Endocrinology. With over 30 publications in reputed journals, he is an authority in endocrine research. Dr. Mahesh by 2019, he has done extensive research experience, includes roles at Columbia Asia Hospital and CMC Vellore, where he also served as assistant professor, showcasing his commitment to advancing endocrine care and education. Thank you for joining with us, Dr. Mahesh.
Thank you. Thank you for inviting us.
Thank you. Before we begin, a quick note for our audience and attendees. We encourage you to engage with us. If you have any questions during the session, please drop them in the chat box and we'll address them during the question and answer segment at the end. We have already received a lot of questions, which I personally have responded to them. For further questions during the discussions, please use the chat box or the Q&A. So now let's get started. Let's dive deep into the two Ds that we're talking about today, the diabetes and the diet. We start with first Dr. Vishal. How is diet and good gut health linked to the occurrence and management of diabetes? And how does a bad dietary choices make it difficult to manage diabetes?
First of all, thank you, Happiest Health, for having us.
Thank you.
Thank you, Mahesh, sir, for joining and co-chairing this. And thank you, Kumar, for taking all the pains to organize this. So we start with, as we call the two Ds, that is the diet and the diabetes that we are speaking. And what better place to speak about the gut health and diseases than India, which has been since long concentrating on gut health. And it's known that it's called the second brain. And also it was told that almost majority of the diseases originate from the gut. That's what we are told. Even Hippocrates 2000 years ago told that all the diseases begin from the gut. To give a fact check of what is this gut, we have around 100 trillion organisms in our gut. Okay, that constitutes around 1.5 to 2 kgs. So all the microorganisms, they are called as the microbiota, and the genome of this, the genes of this microbe, they are called the microbiome. Okay, so we have more than 500 specific organisms which are present in our gut. Mainly, if you name few to know, the people should know is like lactobacillus, bifidobacteria, clostridia, enterobacteriaceae, all these things. So there's a ratio called as a good bacteria and bad bacteria. That's what the people know in common terms. So in common terms, if you see, we have, if the ratio is altered, that's why we say that you can have what is called as the diseases. So gut bacteria is known to influence or is an important factor in connecting the genes, the environment, as well as your called as immune system. So how does it do? It provides what is called as uh, your energy homeostasis, okay, your satiety, as well as glucose regulations. Okay, so what happens is if this alteration, so this gut can be just seen as the microbe can be seen as a wall that is preventing any further toxins entering into the body. The very famous movie that is called Bahubali, where the person tells that I'll prepare an iron wall to protect against the enemies. It's same as that. It protects an integrated wall against the other organisms, and this integrity is provided by many dietary factors that we produce. That is called the short chain fatty acids. Okay, mainly the butyrate, the propionate. So what happens is if there is alteration in the gut, the common term that is the leaky gut. Once the leaky gut occurs, what happens is the organism moves into the blood producing a constant metabolic endotoxin. That is what we call a stage of chronic inflammation in the body, where you can have insulin resistance, and this insulin resistance can lead to what is called as diabetes and or maybe obesity also. This is the most simplest term that I can explain how this can occur. Now, what does diet play a role? So the composition of gut microbes depends on a various factors, mainly the diet, the exercise, as well as the medicine what we take. So various diets have been proposed, mainly the plant-based diet or the animal-based diet. That is the main concept that is occurring. So it is seen that a Mediterranean diet, that is mainly a plant-based diet, increasing vegetables or a fruit, that increases your ratio of increased good bacteria. That is we call aerobes to anaerobe ratio. And it is shown that by increasing this, you have reduced or increased production of short chain fatty acid in your gut, which maintains that gut microbe integrity. Okay, this leads to decreased leaky gut, and this will lead to decreased inflammation in the body, and this leads to decreased insulin in resistance. In turn, can lead to decreased incidence of prediabetes or diabetes. So this is how the gut, as well as the diet that we take, mainly the probiotics or the prebiotics that we call, we can discuss further if you want about
Right.
this. This is how it helps.
Right. Okay. Okay. Thank you, Dr. Lahoti. Just wanted to understand from Dr. Mahesh. So people often associate diabetes only with sugar, but fail to recognize the side effects of high calorie diet. Can you elaborate on how a high calorie diet complicates diabetes management, doctor?
Yeah, thank you for the question. So most of the time people, when we also see a patient also, he tells that I don't take sugar at all, but still my sugar is there and I've got diabetes. So
Yes.
people who have diabetes also think that they are not taking sugar. How did they get diabetes? So what we need to understand basic physiology is that the body is an amazing machine that is able to convert anything into glucose. So whether we take carbohydrate, fat or protein, all three can be converted to simple sugars that we call as glucose or sugar. Sugar is a common term used for glucose and all its other forms of carbohydrates that we consume. What we need to understand is that diabetes is because there is too much of load of glucose that is in the form of extra carbohydrates or sometimes high calorie diet that includes the fats that are usually come as fast foods or fried foods that we see outside or even at home. And the combination of these, because the fat gives 1 gram gives 9 calories, whereas the carbohydrate is 1 gram will give only 4 calories. But that doesn't mean that fat is bad or carbohydrate is bad. What we have to understand is that there are two types of food. One which gets digested fast and gets converted to glucose fast in our body, and the other is the food items that take that undergo slow process of converting into sugar. So therefore, we use the term as complex carbohydrates or healthy fats that have also antioxidant properties and anti-inflammatory properties. So high calorie diet means that we are consuming too much of either fat or carbohydrates that in the form of cereals, carbohydrates, and in the fat we have all these food substances that are available, fried foods or the junk foods that are available outside, that we are consuming in quantities that are more than what we need. So usually we used to consume say 1700, 1900, 2000 calories when we were maybe 20, 30 years ago, when our physical activity used to match our energy requirements. But today for most of us, we are traveling either by a vehicle, or even though you don't have a vehicle, you still use your phone to get the vehicle to the place where you stay. So your physical activity has reduced by almost 50 to 70%, but your calorie intake, your hunger, stomach size, everything is remaining the same. So you are consuming more calories. So high calories doesn't just mean that you are consuming too much of these items beyond what you need. It is also that you are not utilizing the ones that you are usually consuming for your daily needs also. So we have to increase our physical activity, reduce the simple carbs, which could includes the white rice, maida, potatoes, all the fried foods. We have to reduce them, and at the same time increase the complex carbohydrates that are there in the form of vegetables and fruits and whole grains, and also consume healthy fats that are naturally there. The olive oil, canola oil, even the groundnut oil, coconut oil, all are should be included. If you consume only one type of fat and only use fried items, you will end up in high calorie diet, which will usually first increase the sugar level, then increase the insulin level, then lead to fatty liver, insulin resistance, and later stage pre-diabetes, then diabetes within a span of just 2 to 5 years. You end up developing diabetes because of the high calorie diet that you consume.
Right. Thank you. Thank you so much, Doctor, for this is a very important aspect that everyone are missing out on. While we cover these two Ds, we'll now delve into a very important topic of natural sugar and the artificial sugar. So this is something that everyone are aware of it, and needs a lot of questions that needs to be addressed in this particular topic. Dr. Lahoti, just wanted to understand artificial sweeteners marketed as sugar free claim to be diabetes friendly. Are these advisable for diabetics?
Okay. So let's think what are these artificial sweeteners? These are nothing but agent that will provide you sweet taste without any nutritive value. Okay, non-nutrition sweeteners, or they're also called as the high intensity sweeteners. So these are nothing new. There's not new. These have been there since 1870s. Okay, so how it was discovered accidentally. Okay, so the first artificial sweetener that was discovered was saccharin. Okay, it was in 1870s.
Okay.
So 1870s was the first time that the artificial sweetener was discovered, and later on there were new sweeteners that were added to the market in the 20th century. That is the aspartame, the cyclotame. Okay, so few things that are right now that is going in this, the carcinogenic properties of this. Okay, so when the cyclotame was added, it was found that the cyclotame is the one that was causing carcinogen, and that was removed from the market. From then, the US FDA, that we have, the Food and Drug Administration, has approved 6 artificial sweeteners. So we have, that is saccharin, aspartame, we have neotame, acesulfame, and one more. Okay, so these are 6 approved from US FDA to take. Now, are they approved to take on a widespread basis on a day-to-day basis? That is not done still. Okay, so why? Because they are used in majority of food industries now. The uses of these are in the food or beverage industry. We are using it for the weight management, or we are using it for the diabetes control, or for oral health. Okay, so we dive down into each of them. For the weight, it is shown that if it's used for widespread, studies have shown that it is not causing any weight loss. Okay, the only subgroup of population that they have helped is only the people who are able to undergo bariatric surgery. Before that, when this artificial sweeteners were described to them, they found that these people were able to lose weight, and subsequently when they underwent the surgery, they could be able to maintain that. With regard to diabetes, it was found that this diabetic population in 2022, the most recent one, WHO, that is the World Health Organization, found that there's no help in the diabetes. In fact, it's a contrast one. They found that people taking this overweight, and they may lead to increased fasting plasma glucose, obesity, and maybe increased incidence of diabetes also. Presently, that is what they have said.
Yeah.
To the side effects, the major side effect that they're seen is one that is going on in the news is the carcinogenic effect. Okay, so
Yeah.
the widespread studies in humans have not shown any carcinogenic effect. Only in the rodents they have found that maybe it is having some carcinogenic effect.
Yes, doctor. Yeah. Yeah. So Doctor, yeah, yes, please continue.
And whether any benefits right now we suggest that people who are diabetic, if they're very used to taking sugars, maybe in the tea or coffee, we ask them to take it once in a while and start having sugar-free tablets once in a while and get used to the food without sugar and then gradually withdraw it for a short period of time. They can do that. That will be helpful.
Okay, right. On that note, Dr. Mahesh, people with diabetics are advised to avoid sugar foods. Well, we are talking about these artificial sugars, but however, fruits have a high natural sugar content. That's something that raises an eyebrow. Should diabetics consume fruits? If yes, what's the right approach, doctor? Are there any fruits they should avoid?
Yeah, so usually the fruit is giving sweetness because it has more fructose in it. So the more sweet the fruit is, the more fructose it has. And the fruits go through a process of being unripe, then semi-ripe, then ripe, then fully ripe. So we have to understand that that process is to increase the sweetness of the fruit, and at the same time the fructose content will increase. So if you take these fruits which are very high in fructose or which are very sweet, usually it is the mangoes, the bananas, and the sapodillas or sapotas, what we call. They are the common ones which have very high, sort of sweetness.
Okay,
And yeah, that sweetness makes you eat them not just in a small quantity but also in a large quantity.
absolutely.
So, and second thing is that most of these fruits, the fiber is less because you don't use the peel when you are eating these fruits.
Yeah.
So there are fruits which are not having very high sweetness, especially if you take the guavas, berries,
Mm.
apples, pears, peaches, and apricots. These are all where you can eat the entire fruit. So the first criteria to say whether you can eat the fruit is, can you eat the entire fruit, including the peel, so that you're not just taking the pulp, but you're also taking the fiber that is covering the fruit. So the fiber itself will reduce the glycemic index of the fruit, and the sweetness is not so much that you feel that you can consume more and more. The more sweet it is, you feel like more consuming it often. So there are
Absolutely.
certain fruits which are low in glycemic index, which include the pears, oranges. Oranges also are of two types now. The old one oranges are not very sweet, but the newer ones, you can see the color, they are looking very bright, orange. So those fruits where if you eat and you feel that the sweetness is more, that is better to avoid. But if you feel the sweetness is less, then you can consume the entire fruit. Those are the best fruits like guava, papaya, which is not very ripe. Papaya also you can have the variation, but papaya which is not very ripe is actually good for your health. It also has flavonoids, antioxidants, and good minerals and vitamins. So you can consume these fruits: apple, papaya, guava, berries, oranges, musambi, sweet lime, and avocados, pears, and some berries as a few fruits that you can consume on a daily basis. Usually, we say the size of the fist is how much you can consume per day. If you look at your own fist and see how much it is, usually it is around 100 grams per day. And preferably, should you consume during the daytime, because whatever the glucose is there in it is utilized through your normal daily routine of physical work, rather than eat the fruit and sleep so that it gets an extra calorie. Then will actually, because it is too much, it will get converted to glycogen, and if you already have fatty liver, it will the glycogen stores are complete, so it will become fat. So fruit should be preferably consumed during the daytime, as either during the breakfast or maybe evening before your walk or something. You can have a fruit.
Right, right. Okay. Dr. Vishal, what about jaggery, consuming jaggery?
Okay. So jaggery, it's also like, how is it made? The answer, we can answer the question. Okay. So
Yeah.
jaggery, it's also called the superfood sweetener, okay, or it was called the non-centrifugal sugar, okay. So how is it prepared? It is prepared from the sugarcane juice itself. The sugarcane juice is extracted, okay. Then it is put into a container so that the things are settled down. Okay, then the juice is taken off into the large container, and then this juice, which is the sweet part of the, then this is made into the blocks that we call good or jaggery. Okay, so basically what we are seeing is it is nothing but the sugar that is again converted in the form of this one. But how is it different from sugar? So sugar is what is we call refined. If you take a loose term, you can call it an unrefined sugar. Okay. So
Okay.
the common thing with sugar is called as empty calories without any nutritive value. That is correct. Okay. So we don't have any nutritive value for the sugar. But if we see for the jaggery, because of it is this product, the way it is produced, it has got some nutritive value. Okay, if you see the difference is that 100 grams of jaggery will give you around some 11 grams of iron, okay, some vitamin and some other nutrients also. Okay,
Mm-hmm.
but the
Mm-hmm.
problem is you don't consume 100 gram at one. Okay, so hardly you can consume around 10 to 20 grams at one go, which will be around just 4 grams or some 4% of your recommended daily ounce of your iron intake. Okay, so the if you see gram by gram, sugars are empty calories. Okay, refined sugar is an empty calorie. If you see gram by gram, definitely jaggery has got higher nutritive value. But can we consume jaggery once you're diabetic? No, it's still not, because this is also a high glycemic food. Okay, so as sir told, carbohydrates can be divided based on the ability to increase the blood sugars. Okay,
Yeah.
so if you see, jaggery also will cause a very high blood sugar immediately when you consume it. Okay,
Okay.
so this is what we call the high glycemic food, and it blunts the glucose response. So that's why you are not able to. Maybe if you are a non-diabetic, the better option is to take a jaggery in a limited quantity instead of taking a refined sugar, but that too in a limited quantity in this era of the world. Okay. And considering if you are a diabetic, it's a strict no. Sugar, jaggery, and yeah, still not because both all of them are classified as high glycemic foods.
Okay. Okay, jaggery is also a strict no. Okay, thank you so much, Dr. Vishal. So now let's bust some common food myths about diabetes that are circulating on the internet and among the public. Again, I'll start with Dr. Vishal. The internet is flooded with advice about diabetes, should what you should eat, what you shouldn't eat, but misinformation is rampant. Could you share some common food myths you have encountered? Like, for example, one, of course, the jaggery. It's people say that I eat jaggery better than sugar, but any other common food myths that you've come across, doctor?
I'll divide it into two parts. One is the myth, and one is being unaware. Okay.
Okay.
So, what a myth is a belief that runs in the population that maybe because of poor education, culture, social beliefs. And what happens with myth? It's just passed on to generation,
Yeah.
and it takes a lot of mindset and behavior change to change this myth. Okay. So, and one is being unaware of what are the helpful food that will help us. Okay. So, common myth that you have told us, one of them that we have discussed, as told us, if I eat sugar, I get diabetes. Okay, it's not that only the sugars. Okay, it's the nowadays it's the initially when diabetes started, it was thought it's just the fat. They were asked to avoid fat later on. Then now the concept is it's more of the carbohydrate. Okay, even in carbohydrate, it is different. Okay, not all carbohydrates are same or similar or equal. Okay, some are classified as high glycemic or higher, which have got higher capacity to increase your blood sugars faster. That is we call high glycemic index foods and high glycemic load foods. Okay, so these are the foods that we ask to avoid. It's not just the sugar that will cause you the diabetes or maybe obesity also. It is all these high glycemic, high energy foods that is causing the problems because it causes sudden spikes in the blood sugar. It puts a strain on your beta cell that produces insulin, and that causes faster wear off in the beta cells. So this is one of the most common myth. Okay, so what to do? You have to mix a balance of both high and low glycemic index foods. Okay, that will blunt the glucose response. The second is on medicines. The people think that they can eat and you can do everything once you're on medicines for diabetes. No, that's not true. The three pillars of treatment are diet, exercise, and then medicine. Okay, without the first two, the third is not very healthy. Okay, so after taking medicines, also you have to remember that you have to follow a diet. Okay, what you eat, how much you eat, what time you eat, all becomes important. This portion size, the variety of the food, the complex carbohydrate, the mix of high glycemic and low glycemic. Okay. The third is what the initial was the fat. Now it is much, we are educating people through this platform that it's not just the fat, it's the complex carbohydrate also that is causing, it's the carbohydrate that's causing the diabetes also. The second part, being unaware of the beneficial effects of the food also. So many don't understand that the importance of fiber also. So fiber is very beneficial. Even it's recommended around 15 to 20 gram per day. It blunts the response, the glucose glycemic spikes, improves the gastric motility, slows the gastric motility, and improves the glycemic control. Okay. And the importance of protein also is underestimated in countries like us. We don't understand how much is important the protein part also plays. So as we just talk about the work-life balance, I maybe think one word where balance has to come is the diet. Okay, balanced diet is more important. Have a 40 to 50% carbohydrate, protein 20-25%, and 20% of fat, along with your vitamins and mineral. That will help to reduce the risk of developing diabetes.
Okay, okay. Thank you for this detailed list, Doctor. Dr. Mahesh, so diabetics are often um, led to avoid carbohydrates, especially rice and wheat-based chapatis. What's your advice on how diabetics can consume carbs? Should they completely avoid rice and chapatis?
Yeah, so there are two groups of people who are flooding the internet market, if you say. One
Yeah.
group is the anti-wheat group, the other is the gluten group, that is called as the wheat group. The other
Okay.
is the rice group. They hate rice, they just don't think that rice is very good, or it is very bad. So now
Okay.
we have to understand that what is a grain. Grain is something that we usually use the word refined grains. Anything that is refined means that its outer covering, which contains fiber and minerals, is off. So any grain that is refined is not good, be it either wheat or be it either rice. Next question comes, can you take only one type of grain? One grain cannot have all the nutrients inside it.
Okay.
So if you ask in a way, when you're driving a vehicle four-wheeler, which wheel is important? Is the front wheel important or the back wheel important? I
Hmm.
like the front wheel, so I will drive only with the front wheel. No matter what you want, if you want to go ahead, all the four wheels are important, are equally important, and we have to take care of them.
Yeah.
So Dr. Vishal said carbohydrates, simple, complex. We just described that. Then the fat and the protein. So they are like the three wheels that are very important. Now the fourth wheel comes is the vitamins and the minerals which are present in the fruits and the vegetables, which are mainly the predominantly the complex carbohydrate. So you have to consume grains, which could be rice, which is not refined. So there is
Mhm.
no problem with rice that is not refined. We usually, some people use brown rice or it is natural red rice, whatever it is. But that also, if you consume three times a day, you will be deficient in many other minerals and vitamins. Same way, if you consume wheat three times a day, you will be deficient in some of the vitamins and minerals. An ideal grain meal will be at least three grains that you are consuming spread over a week. You don't have to consume like morning I have to take one grain, afternoon I have to take one grain, night I have to take the same grain. Then you will end up in deficiency of some minerals and some vitamins. So it is ideal to consume at least three different grains. You include one millet, you include a rice or a wheat, and you can also include today we have different millets which are for 5 to 6 grains. We have oats. We also have quinoa. We have multiple other grains that are there available to us. You have to try one at a time. It is
Right.
not easy to start completely stop white rice or completely stop wheat. So what we usually recommend, try to tell the patient is to try to at least cut one meal out of the rice or the wheat and include something that is a whole grain, which you can start trying. It could be simple, any small millet that you might have used earlier and then you can use now. So some people are happy with ragi, but ragi has a high glycemic index. But if you take the ragi in the form of roti or ragi ball, which is cooler in temperature, then you can consume less, so the glycemic load will come down. So ragi, the glycemic index is high, but the glycemic load can be lowered because the way you consume will have an impact. And if you use a lot of sprouts along with that, with the sambar that you use, you actually can reduce the glycemic load, and which will have an impact by increasing the fiber and the mineral content. You will get a balanced diet. If you take our ancient eating habits, always there used to be two or three grains. Some people use jowar, some people use bajra. So there is definitely one more grain that is there with us, so at least try to use three different grains that are whole grains. And white rice is as bad as maida, and any grain that is refined, including refined oil, is also not good if you are consuming only one type, which will lead to excess of one type of food in you and deficiency of the other essential nutrient that you require for a healthy body.
Okay, okay. Thank you so much, Doctor, for giving us these two sides of the discussion. I would also take this opportunity to thank our natural sweetener partner for today's webinar, StevioCal, while we also spoke about a lot about sweeteners as well. Next up, lastly, let's address the types of foods that diabetics should avoid and why. So, Dr. Vishal, I'll go with you. Can you explain how excessive consumption of processed foods affects diabetes management?
Okay. So basically, processed foods, like who was given this classification? When I was fascinated by going through this. So what is processed food and all this? This is like there's a classification called the NOAA classification, who has divided the foods into four categories. Okay. So he's called first one, two, three, four. The first category is the unprocessed food, which sir was talking about as taking this whole grains. Second category, Nova 2, is called as the just mildly processed ingredients, okay, like your oil or butter. The third is called as the processed food, and the fourth is called as the ultra processed food. Or the ultra processed food are the one which are industrially made, ready to eat. So
Yeah,
industrially made, ready to eat food are the one which are very high energy and high density food. Okay, so they are processed in many ways, depending on what kind of food it is and how they do it. Okay, they have shown that this consuming high energy or ultra processed food continuously for 14 days adds up at least 1 kg at the end of 14 days, give you at least 500 calories extra with extra carbohydrate and extra fat. Okay, so this is what they have told. Now, whether this increases the risk of diabetes, how does it do? Like the same thing what we have discussed, having such high energy density foods, as well as such high adding up to the weight and other things, can again put a stress on your beta cells, cause insulin secretion. The one more thing that was very nice is in this world of personalization, the one thing that is called as the personalized fat theory. Okay, so they say that once you consume a ultra processed food or something which keeps on adding up to your weight and the fat, it is found that individuals have a personalized fat threshold. Okay, it's called a personalized fat threshold. So beyond this fat threshold, the person is unable to store fat in the subcutaneous layers, and it goes and gets deposited in what is called as the internal organs, or the what we call the visceral fat. Okay, like the liver, the pancreas, and this will cause producing stress on your pancreatic beta cells, which produces your insulin, and that is what will lead to decreased insulin secretion and eventually insulin resistance because of deposition of the fat, leading to diabetes. So this is how ultra processed food, which are high energy, high density food, and various studies have been done that shown that you consume extra 10% of ultra processed fat, it will increase your diabetes risk by 10 to 12%. You add on doing this every year, so eventually you will end up in this. Okay, and the second concept you have to remember is the fat threshold. How does this add up? So you keep taking this high energy density food, it is shown that it keeps on adding to the fat, and every person is individualized. We have a personalized fat threshold. If you cross that, that's why you tell I am thin, but still nowadays we are seeing even people who are lean and slim and all, they are having diabetes, because the concept is of the personalized fat threshold. Where you cross that, it goes into your visceral organs, and then you can have declining insulin levels as well as resistance, and eventually end up in obesity as well as diabetes.
Okay, thank you so much, Doctor. Dr. Mahesh, one last question. What are some types of food that diabetics should avoid at all costs? Because in our questions that we have been receiving from last 15 to 20 minutes are all about a lot of foods. Can I eat that? Can I eat this? Of those questions, if you could just answer this question, Doctor. Doctor, you're on mute.
Which are the foods that we must avoid? So there are processing is something that we have to understand as a simple concept. So
Mhm.
anything that has been changed from its naturally available form is a processed one. So if you change that further, then it becomes ultra processed, like Dr. Vishal just said. So ultra processed food are those which get easily absorbed, and they result in very fast conversion to glucose, and they actually just not just convert to glycogen but also fat and deposit in the visceral fat when the personalized fat threshold is crossed. That's why we are seeing people who are younger, less than 30, with diabetes, and also those who are not very obese also with diabetes, because we are thinking that I am taking food not in a big quantity, small quantity, what is going on. So
Yeah.
anything that is ultra is 100% no, which means all the canned fruits, the fruit juices that you see. A fruit is different from a fruit juice. People think they are both the same. A fruit juice hardly has any significant fiber. It's almost zero in that, and it is the pulp removal will ensure that half of the minerals are gone and the vitamins are not there. It is 80% sugar. That's all it is. It's just like a sugar syrup with a flavored sugar syrup. That is what you can call all these juices. So you should avoid all the juices. Next comes the refined grains. All the grains that are refined, like white rice, maida, are to be completely avoided. Even to some extent, we have refined ragi also available, where the color is purely white, and you can hardly distinguish between maida and ragi for that matter. So they are all the refined grains should be completely off the charts. The third is the abnormal saturated fats, which are usually processed meat, or all these fried foods, or the stored meat, frozen meat, and also the frozen foods that are packed, pre-packed, available ready to eat foods that you see, are having an extra layer of chemical that will be used as preservative, and these are not good to be consumed on a regular basis. Once in a while you are going once in a year, or outside where you don't have a choice, where you can eat once or twice in a year, is different from bringing them home. So whatever I am telling you is that they should never be brought home. Your fridge should not have anything that is ultra processed. Your fridge should not have any juice. Your fridge should not have anything that is highly processed in terms of your utilization. The storage in the fridge is actually ideal only for 24 hours. So
Yeah.
whatever you keep in the fridge is that food that you will consume within 24 hours. So today you bring it, tomorrow you finish it off. And it should not be something that you can store for a longer period of time. That means that it is already entered the processed area. Then comes the high calorie fried items like samosa, burger, and these chips and all those things that we are well aware of, junk foods, what we call as. The last group is the fruits, which we had discussed earlier, which are very high in calories. Like, you eat 1 kg of mango, 1 kg of sapota, whereas because as soon as the season comes, then you have watermelon morning, night, afternoon juice. Summer now with the watermelon juice, we are seeing patients come to us exactly after the season. Now, after spring season, they will eat watermelon juice 3 times, and then come in the March end or April with high sugars. Then we have the mango season. Then June, July, they will come with high sugars. Then we have the festive season of Dashera and Deepavali. All the sweets are consumed with jaggery, and they think jaggery is not harmful, and they come back to us in December. So we have to not only tell the patient about this, we have to make them aware about the seasonal fruits that they are good. But raw mango is good. You can have raw mango. Many things you can prepare with raw mango, where the peel is there, and eat mango. But the right mango should be all the four people in the house should take one mango, enjoy the mango, and luckily God has created taste buds only in the tongue. It is not in the stomach. So eat for your tongue, not for your stomach whenever it is tasty.
Absolutely. I think that's the sum up of the whole conversation, I think. Please your tongue, not your stomach. Okay. Thank you, Dr. Vishal. Thank you, Dr. Mahesh, for your insightful responses. It's clear that managing diabetes goes beyond just avoiding sugar. It's about making holistic and informed dietary choices. Now, let's turn to our audience. We'll address some of our questions that we have received on our chat box. I may, with your permission, just take a few questions, Doctor. So, relevantly, you can choose who to answer. Can we take prebiotics and probiotic supplements regularly, as in people with diabetes? Dr. Mahesh or Dr.
Yeah.
Vishal, anyone?
So, yeah, there are a certain group of patients who are diabetes for a longer period of time. They usually have altered gut bacteria,
Okay.
where we use the term as intestinal bacterial overgrowth, where abnormal bacteria is there. So, in them, some of those patients, in consultation with the gastroenterologist, we do recommend people to take for 4 to 6 weeks to restore the gut health. But we should also understand that where is it coming from? It is coming from the nature.
Yeah.
So you have to stop taking the refined item so that you get back the naturally available bacteria into the system. So yes, for a short period of time you can consume to restore the gut bacteria, but if you continue using the same thing, nobody has done any studies seeing taking probiotics for 1 year or so. So most of it is a short-term studies which have seen benefit. Definitely, there is a benefit in the short term.
Okay. Okay. Dr. Vishal, I think this another question. Does artificial sweetener have impact on gut microbiome?
Yes. So it is shown that artificial sweeteners tend to change the bit of gut biome. That's what we told. Whenever you take something orally, you have to be aware of the gastrointestinal effects, the carcinogenic effect, the neurologic effect. Out of the gastrointestinal, it's shown that the people on artificial sweeteners, when they've tested, they've shown that it is increasing the anaerobic bacteria, there is increased ammonia in the cecum, okay, and there's increased undigestive, decreased production of the digestive enzymes from the gut, okay. So it is known to cause a bit of gut alteration. That is why it is not recommended on a day-to-day basis on a widespread use, okay. But definitely for a short period of time to get rid of the sugar habits and to get rid of this sugary drinks and other things, it's definitely recommended for the short term.
Okay, okay. Thanks, Doctor. Doctor Mahesh, I think you can answer this. Can we reverse diabetes by diet only?
By Yeah, we can. We don't use the word reverse in our medical field. We use the word remission,
Yeah.
which means that you can be off the medicines that you are consuming with a diet that will help you lose at least 7 to 15% of your weight when you are diagnosed with diabetes. So there is a 70% chance of remission of diabetes in those with diabetes onset within 5 years of their onset, and usually have a higher BMI, say 25 to 27 or more than that. If they lose 7 to 15% of their weight, then with the help of diet, then they are likely to go into remission. 50 to 70% of them may go into remission, but still another 30 to 50% may not actually go into complete reversal or what we call as remission. So, but in them, definitely the medicines can be reduced. So, with diet is the source of 70% of your problem, because the rest is genetics, your lifestyle, stress, other factors, medicines, and pollution, and all the pollutants and all the chemicals that we might have been exposed to will have a role to play. 70% is your eating habit. So if you can take care of that, then you can definitely expect at least half of that, 35 to 50% improvement in the overall health, that will reduce the medicines and sometimes stop them also. Sometimes we usually stop them for a short period of time, but in most of them we see that after 5 years, if their eating habits change, then they go back to the same state. So there is a reversal that we call remission, but there is a relapse that is known as re-reversal. So both are going to happen if you don't follow strictly the
Yeah.
healthy lifestyle that you have taken to reduce the medicines.
Okay. Thank you. Also, for the attendees and the audience who are present here, Happiest Health has also introduced diabetes transformation program. It's a very small 3-month journey that leads you to the diabetics control with a lot of modules, lot of insightful sessions, and everywhere. You can also visit happiesthealth.com for diabetes transformation program information, or I have also put down the details on the chat box to that number you can call up. Another question, I think one last question we will take, Doctor, is that can homemade desserts be consumed made using date powder, or what about dates and figs instead of sugar? We spoke about jaggery and sugar, but this is about dates and figs. Anyone can answer, both of you.
Yeah, the dates is a very tricky thing because there are so many dates that you will be wondering which is the actual date. There are maybe 50, 60 varieties of dates.
Yeah.
You ask which was a healthy date. If you take 20, 30 years ago, we used to have these dates available in India where just eating one date would have probably broken your teeth if you were old. So those are the dates that are rich in fiber and low in sugar and those things. But today, I think hardly available anywhere. So
Yeah.
dates are a no-no for those with diabetes. Definitely no. For those without diabetes, you can consume one date a day. There is no problem. But those with diabetes, definitely dates are a no. Whatever the date powder, all those things are all same effect. It's not. It's just a different name. It's like a old wine in a new jar. That's all.
Okay. Dr. Vishal, I think you can take this last question. So very crucial thing. So what is the effect of taking diabetics medicine for a long time? Is there any side effect for taking it for 8 to 10 years?
No, no, there's no such things. Like you have to balance it out whether you want to keep your sugars at 400 and have complications of that, or you want to take medicines and have a lead a healthy life. Okay, not everyone will have the side effects of medicines. Okay, it's only in few people you will have it. That's what we have. Like everyone will respond differently to medicines. There's a term called pharmacogenomics that will come up maybe in the future where you test the person whether he's the ability to metabolize those medicines and have least side effect. It's already done in few cancer patients, okay, few cancer drugs. It's not come up in a big way in the diabetes medicine, maybe in the future. So you have to understand that you have an increased life expectancy in every country now, okay, and with sugar it is clear that the life expectancy will go down if you don't control it with the hbnc of more than whatever the it's recommended. Beyond that we have found that the life expectancy will go down, you have a lot of complications and increased mortality. With medicines, it's shown that the mortality reduces, the morbidity reduces, you will have less complications. Now, whether the side effects come, we don't get to know unless we put the patient on the medicines and we follow it up. Okay, not everyone will have it's only in few, one in few lakhs that have it. That we come to know what those people also when we follow up in 2 to 3 times. We come to know on their kidney function test and other things whether they tolerate the medicines or not, and maybe in future using a few what I told the term that pharmacogenomics, we may come to know prior whether this person is being able to, and we have newer classes of drugs with less side effects now. Okay, so I don't think you should think of not taking medicines and avoid it completely and have complications. That's not a good idea.
Okay. Thank you, Doctor. Once again, thank you all for joining us today and for your active participation. I hope this session has provided you with valuable insights into managing diabetes through better dietary choices. A special thanks to Dr. Vishal and Dr. Mahesh for their time and expertise that you have shared with us today. Also to our natural sweetener partner, Steve Cal. For more health related insights, visit our website www.happiesthealth.com and stay tuned for upcoming webinars. Have a great day and stay healthy.
Thank you.
Thank you,
Thank
Doctor.
you.